This Monday, NFL reporter Erin Andrews recently made a startling announcement that she had cervical cancer. She says doctors successfully removed the cancerous tissue and no chemo or radiation would be needed. Now, ovarian cancer also making headlines recently as health officials link talc in baby powder and other products to cancer possibly. Dr. Sharon Thompson of Central Phoenix Obstetrics and Gynecology joining us this morning with what women of all ages should be thinking about. Thanks for being here.
Oh, thanks for having me. Those are two headlines about important issues in women's health. And they're sort of two diametrically opposed conditions in terms of the reality of women's lives. So almost all women know about pap smears, right? You go annually, or you used to go annually to get your pap smear. Women are quite good about doing that. The pap smear is a screening test for cervical cancer. And what it does is it allows us to catch early changes in the cervix before cancer occurs, so that we can either prevent cancer or find it in the earliest stages where women will not need radiation or chemotherapy, and it extends the lifespan. So we're very, very, very good at finding early stages, pre-cancer we call it, and preventing cervix cancer. Ovarian cancer is that opposite story.
Okay, so ovarian cancer is sort of a silent killer, right?
Absolutely.
Where you don't necessarily show signs and you're not going to see it in an annual exam.
Yes, there's no good screening test for the general population for ovary cancer. The silver lining is, if there is one, is that ovary cancer is not as common. Without pap smears, cervix cancer would actually be the #1 cause of cancer in women and the #1 cause of cancer death. It is ovarian cancer today because we have no screening tests.
Wow. Yeah. So what can be done about this? I mean, it seems like this would be a focus of research moving forward. We know that men take, is it the PSA blood test to look for prostate cancer? Is there a similar screening that can be done with the blood for women?
There is not a similar test for ovary cancer. For cervix cancer, there's a pap smear, and it is wonderful and works really well. For ovary cancer, there is not. So what we say to women is this: one, ovary cancer is not common, so don't sit home worrying about it. Second, if you have new symptoms like bloating, like feeling full very quickly, and that's brand new for you, don't sit home and dismiss it. At least give a call to your doctor and get checked out. Because what we find is that when we look at women who get ovary cancer and they look back, they say, oh, well, for the weeks prior I had these vague symptoms. This is one time where vague symptoms, you want to call your doctor if it's new for you.
And then when you see the doctor, will they likely send you for some sort of an MRI or an ultrasound?
They'll send you for an ultrasound, and they may do a blood test. Now, women who are at higher risk, who have family members who had ovary cancer or who have the gene that can cause ovary cancer, those women are in a separate group, and they should be talking to their doctors right away about what they can be doing.
Making sure the doctors know about the history.
Absolutely.
And now more and more we're seeing at least the conversation and considering of having the ovaries removed prophylactically.
That is one way to deal with it if you're at very high risk for ovary cancer, yes.
But a much more complicated conversation if women haven't had children just yet.
Absolutely. So if you know that you're at high risk because of your family, because you know you have the gene in your family, you definitely want to sit down and have that extended conversation with your provider.
Oh, Dr. Thompson, thank you so much.
Oh, you're welcome. Thanks for handling this topic.
Doctor, that's so easy to speak with is what we all need to be in our best health possible. Thank you so much. Scott?